Hello, my name is Kuki Kangaki, FYBPT, enrollment number 069, and this is my rubrics 2 presentation on the topic 6-minute walk test. This is physiotherapy in cardiopulmonary conditions. So, first off, what is the 6-minute walk test? This is a sub-maximal exercise test that measures the functional exercise capacity or cardiorespiratory fitness of an individual. Now, we're going to get into more details later. What are the indications of the 6-minute walk test? This test is used to assess functional exercise capacity in patients with conditions such as chronic obstructive pulmonary disorders, interstitial lung disease, cystic fibrosis, where the cardiac or respiratory systems may affect the patient's exercise capacity. So, this is a diagnostic test in cases of cardiac or respiratory conditions. We can also use the test for cardiac conditions such as heart failure. Now, pre cardiac surgery, the 6-minute walk test can also be performed, and post cardiac surgery, say CABG or cardiac or heart transplant surgery, the test can be performed to monitor the patient's progress. The test can also be used to monitor disease progression if the patient has poor results, say they cover a small area during the 6 minutes, then this is indicative of a higher disease severity. And if they cover a large area, a distance during the test, this is indicative of a lower disease severity. And finally, the 6-minute walk test can be used to monitor the patient's response to physical therapy or cardiac or pulmonary rehab. Now, contraindications of this 6-minute walk test, we have absolute contraindications such as unstable angina, that is chest pain of cardiac origin, myocardial infarction. We have metastatic carcinoma because there's a risk of this cancer metastasizing or spreading. And we have unstable hypertension, and relative contraindications are subacute injury in the patient, an SpO2 of less than 90%, and acute illness such as fever or limiting orthopedic conditions like osteoarthritis. Now, what are the equipments required for the 6-minute walk test? We require a stopwatch or a timer. We require a 30-meter marked track course. We require a chair so the patient can rest during the test, a blood pressure monitor, a pulse oximeter, and cones so the patient can do a U-turn at the end of the 30-meter course. And finally, we require a phone and emergency equipment in case the patient goes unconscious or faces any sort of medical issues in the course of the 6-minute walk test. Now, let's move forward to the procedure proper. So first, the preparation phase. We need to explain the test and its purpose as well as its steps. We need to measure the patient's vitals, blood pressure, the SpO2, the heart rate, and perhaps take a scale of dyspnea, such as the Borg scale of dyspnea. Ensure the patient is wearing comfortable clothing and footwear, as we do not want the patient to injure themselves in the course of this test. What are the instructions of the patient? You should walk back and forth along the marked track at your pace. Rest is allowed if needed. Resume walking as soon as possible, or as soon as able, rather. If you feel any form of extreme breathlessness, dizziness, or discomfort, then you are allowed to stop the test or take a break. Now, it's important to encourage the patient during the test. At the end of the test, after the patient has walked for 6 minutes using the stopwatch or the timer, the total distance is measured. So you instruct the patient to stop the test. Now, normal values range for 400 to 700 meters for men, 350 to 600 meters for women. And the interpretation of the test, a distance greater than 80% of the normal values indicates normal functional capacity, and 60 to 80% of the normal values is a mild limitation, 40 to 60 percent of the predicted values is moderate limitation, less than 40 is severe functional impairment. Now we've done the 6 minute test and we can proceed to conclude clinically what the results are. Thank you very much and have a great day. Bye.